Okay. Hello, welcome everyone. I'm so happy to have you all here, and I appreciate you joining us this Tuesday morning. I'm Dr. Nevneert Nipper. I'm a naturopathic doctor, and I'm presenting this webinar on how to address probably one of the most pervasive concerns that face North Americans, which is, of course, sleep. It would probably be a rarity to find anyone who has no experience with sleep issues, either for yourself or someone you know, either currently or in the past. And hopefully today, what we'll do is get some perspective on why it's so ubiquitous and what we can really do to help patients as well as customers um, uh, navigate this space. So before I get started, I just want to go over a few housekeeping items today. There will be a Q&A session at the end of the presentation, and if you locate the question box to the right side of your control panel, you can ask questions throughout the presentation, and at the end. Please note that this is being recorded for future distribution, and the content of this webinar has not been evaluated by Health Canada or the FDA. It's really meant to be educational in nature and should not be taken as medical advice. So we always want to ensure that you're consulting a qualified medical professional to see if a diet, lifestyle change, or a supplement is right for you specifically and your needs. Any of the supplements mentioned today are not intended to diagnose, treat, cure, or prevent any disease. They simply speak to certain treatment opportunities or options. The opinions of myself are my own and do not reflect those of Advanced Orthomolecular Research, Inc. So, now that that stuff is out of the way, you may wonder, who am I to speak on such a subject, other than the fact that sleep is like my third favorite pastime. And spoiler alert, the other two are laying in bed and napping. Um, I'm a naturopathic doctor, and I do a lot of work in the travel medicine space. I mean, pre-COVID, but still. It's one of the top concerns or complaints often revolves around jet lag and not losing those, precious moments to take selfies in front of all those tall buildings, to trying to get into that right time zone. So this really led me down this rabbit hole of the complex and fascinating world of sleep optimization. So today, what we're going to be covering is a few aspects regarding sleep and the funny thing that our bodies do, why we need to power down, and how our lifestyle may not be quite conducive to getting the best type of sleep. Finally, we're going to round out the discussion by providing some insights into what are the best options for sleep supplementation, as there seems to exist this plethora of sometimes well-intentioned but perhaps ineffective sleep supplements and teas and balms and gummies and chocolates, oh my. So let's get started by really going back to understanding our biology, our natural on and off buttons, the creation of what's called the diurnal rhythm, our circadian clock, meaning there is this internal rhythm that's related to an organism's adaptation to its environment, so to the light and dark or day and night cycles of the planet. This chronobiology is kind of the framework that enables such a rhythm to form. It helps control sleep patterns. It controls our feeding habits, our body temperature, blood pressure, hormone release. And as this molecular clock plays such an essential role in numerous tissues. So within our brain, there's the hypothalamus, and within that exists the suprachiasmatic nuclei. So these are the master pacemaker cells. through both neural and hormonal transduction. This SCN communicates with the peripheral organs and the tissues, and it synchronizes these clock gene expressions. So many organisms generate this endogenous or internal circadian rhythmicity based off of that. Some of the key features and the reason it's such a ubiquitous phenomenon is that in humans, this circadian rhythm is a self-sustaining mechanism. It's approximately 24 hours in the physiological oscillation, which we know. It requires an input mechanism to signal from the environment the time of day. So those are the light signals through our skin and eyes. And then it requires an output mechanism, such as hormones and neurotransmitters that are actually going to alter the behavior, physiology, and metabolism, things like your body temperature, endocrine secretion, sleep-wake cycles, locomotor activity. And there exist a few key players. So melatonin is kind of the one that we always talk about. It's a neurohormone and it reciprocally activates the SCN at 2 receptors. So there's melatonin type 1 and melatonin type 2 receptors. There's serotonergic input, and that happens at somewhere called the raphe nucleus. And this modulates that pacemaker through the serotonin receptors. Adrenal gland, which helps us communicate the time of day information from that master pacemaker to the peripheral tissues, and it does so through glucocorticoid secretion. And actually, nocturnal light disrupts that process. Gene expression activation happens through those output measures. So again, that light exposure is going to result in altered gene expression, and that will either upregulate or downregulate depending on the tissue. So there is this genetic component. As I mentioned, the input of course, is that exposure to light. So the light resets the timing of the circadian clock and the rhythms that it controls. So there's a seasonality. Often it's measured from timing of the melatonin rhythm, but it also can include cortisol, again, like I mentioned, the core body temperature and circadian gene expression. That's how we know we're hitting these marks. So the aim, of course, is always a consistent and extended exposure of darkness to maintain that optimal circadian health and hopefully uninterrupted. So we really want to focus on when those light dark cycles are happening, but of course sometimes we've evolved physiology to override that. Otherwise, you know, Canadians, we'd often be in bed by 4 p.m. and we'd probably morph into bears and start hibernating, but obviously with the function of electricity we have overridden some of those. So another influence in kind of almost a poetic turn of events is aging, and that is when we kind of get the opportunity to sleep more, we almost can't, because our clock is starting to reset and that rhythm begins to change. So let's discuss the melatonin a little bit more. It's a circadian rhythm synchronizer, and disruptions to melatonin levels are obviously linked to a number of sleep disorders and chronic sleep deprivation. And it's that self-fulfilling cycle. So during the evening hours, serum melatonin starts to rise, and it reaches its peak concentration around 2 to 4 a.m. And after which those melatonin levels should start to decline again until they reach a daytime low, right? You don't want your melatonin to be really high throughout the day, otherwise you'll be quite sleepy. So for melatonin synthesis, you can see here on this chart, tryptophan is taken up by these pinealocytes from the blood, and it gets converted into 5-HTP, or 5-hydroxytryptophan, and then that again is converted into serotonin. by a 5-HTP decarboxylase. So before serotonin is converted into an acetylserotonin, um, there is a process, and then it's that NAS that actually gets converted into melatonin. So the serotonin is not the immediate precursor. And then the melatonin is secreted directly into the bloodstream or into the cerebrospinal fluid. So melatonin replacement therapy mimics this normal endogenous or internal melatonin. It can actually correct a relative melatonin deficiency and help favor that sleep initiation, reset that circadian clock. And really, it allows for persistent sleep as we require for our circadian rhythm. So there are a number of, I guess, concerns and things to consider relating to supplementation strategies. So there's the short-acting sprays or liquids, and then there's small doses that you can kind of titrate up. Some have an immediate release or they're timed release. And then there's concerns about blocking or tolerance or blocking that endogenous production, and how these formulas can result in prolonged elevations of that melatonin well into the day. And all of these concerns are quite reasonable. So exogenous melatonin has this varying bioavailability when we're supplementing, and this is really due to an extensive first pass effect on the liver. However, we do see that exogenous melatonin will help increase the endogenous or natural production in a dose-dependent manner. But we do see that even at small doses, there is a benefit seen to administration. So even at 0.5 milligrams, we're seeing a benefit. It's also really important to consider that this maximum concentration reached after melatonin administration, so you take your melatonin, we reach that maximum concentration higher the older we get. So the concern is that we might extend it into daytime, whereas with shift workers, we know that they can tolerate much, much higher doses, even up to 20 milligrams. And they're not reaching that peak concentration in the day. So controlled release formulas seem to most closely mimic the natural physiological melatonin levels, but then we always need to be concerned about a prolonged elevation of that melatonin, especially for those older adults, so that may not be advisable. Whereas sprays and liquids do enable kind of a dose titration, aka you can build up or go at your own pace. And this might be particularly beneficial in populations that kind of had varying sensitivities. Of course, there's that concern with the very vivid dreams and that morning grogginess that I think a lot of people experience. And that can dissipate over time in most people, but it can also prevent individuals from taking it, and some people are just more sensitive to it than others. And this really is related to the fact that the REM cycle, which we'll talk about in a minute, is mediated by your circadian rhythm. And melatonin is a pacemaker for that REM cycle, meaning so you would have more of those REM cycles, so really vivid dreams, and then also you're more likely to be woken up whilst you're in a REM cycle, so you have more of that grogginess. And actually, on that note, I think it's really important that we try to understand what is this a relationship between the circadian rhythm, so this natural rhythmicity, and then also with our sleep-wake cycles. So I had mentioned earlier when we were talking that they can actually be independent. And at other times, they're very dependent on each other. So ideally, what we want is our sleep cycle to coincide with this diurnal rhythm and that light-dark cycle. It's better to sleep when it's dark. We want that to happen as best as possible. But like I said, we've also evolved in many ways to kind of shift our sleep-wake cycles that don't always match up with when it's dark, we sleep. When it's light, we are awake. So a sleep cycle is the progression through various stages of non-REM and REM sleep to REM sleep, and then you restart it. That's why it's a cycle. It keeps going. So the pre-sleep alpha waves, they're those nice and calming, but not necessarily drowsy. But they really help keep in mind, they're not drowsying. And that's important later when we discuss L-theanine, which I'm sure you're all very intrigued now. But that happens in pre-sleep. Then we go into stage 1. This is where muscle tone throughout the body starts to relax, and we actually start seeing these brain wave cycle changes. So the activity begins to slow. You can really easily be taken out of this stage, and occasionally people may experience something called hypnic jerks, which I'm sure you've all seen in the wild when people are on public transit, educational institutions, and occasionally during webinars. And hopefully not this one, but it's where they do that jerking of the head and they're suddenly awake. So those are the hypnic jerks. Anyway, stage 2 happens, and this is approximately 40 to 60% of your total sleep time. And it's really mediated by these theta waves. And they're actually starting the restorative functions that we associate with sleep. So that's things like memory consolidation. It's not the bulk of it, because the bulk really gets to the main event, which is stage 3, and that's really that restorative stage. And it doesn't last as long as stage 2, but it's deep sleep, and it's really defined by these delta waves. So during sleep, human growth hormone is released, and it restores your body and muscles from kind of the stresses of the day. So again, it's deep and nutritive. Your immune system is also starting to restore itself at this time, and much less seems to be known about the deep sleep, in particular in reference to the REM sleep. But it is during this stage that the brain is also refreshing itself for new learning the following day. So hopefully everyone had a good deep sleep yesterday and they're retaining a lot of this information. So, the students who want to pull those all-nighters, it is not worth it, because you're disrupting your ability to actually learn or consolidate the information that you're studying. Then we get to the kind of most notorious stage, which is our REM sleep, or rapid eye movement. And it is kind of a funny phase, because from a brainwave perspective, it almost looks like you are awake. It first is occurring 90 minutes into the sleep-wake cycles, and it's really short at that time. And then the subsequent REM cycles, this phase gets a bit longer and longer. So you can wake up, and you can wake up a little bit more easily in this stage. But when you do wake up, like I mentioned earlier, it can leave you feeling really groggy or oversleepy, because you're in this highly active phase. You also hear where your heart rate increases, your blood pressure rises, males develop erections, and the body loses some of its ability to regulate its temperature. So that's why sometimes controlled room temperatures are helpful. You can also get, you also should get muscle atonia or muscle paralysis. And this is really a protective means to keep one from acting out their dreams. And actually, there is a fun fact: some people don't get this muscle paralysis, obviously, and therefore you kick and thrash like you really are fighting off that three-headed dragon. And actually, the lack of this paralysis, this inability to hold that muscle atonia, is actually related to an increased risk for cognitive dysfunction. And we'll cover that in a little bit, but it's just very important that each of these stages happen in a sequential manner and happen as they should. So how does this sleep change throughout our lives? We know that there are stages, and anyone with a newborn, I'm sure, can attest to the fact that um, there's definitely changes that happen. And if we observe EEG and sleep-wake cycle states from, the fetus to preterm infant, term infant, preschooler, adolescent, adult, and then senior, it does follow in this very orderly manner. And often it depends on the maturation of our central nervous system. So, how mature are we going through these phases, and how responsive are we to our sleep wake cycles? So, the neurological, environmental, and genetic factors, as well as any comorbid medical or neurological disorders, are really going to significantly affect the progression through these stages. So we can go through those. Newborns, as we know, have this polyphasic pattern, hence those repeated wakings, because it's associated with feedings. They need multiple feedings, so they have multiple sleep wake cycles, and more frequent arousals. And it's interesting because parents who are, presumably adults, they have a monophasic pattern. So they have one phase and they're not getting up multiple times. So they really are sacrificing their circadian rhythm for this little baby. So, I mean, it's a good thing that babies are cute because you're giving up your circadian rhythm. So for infants then, and children, eventually they start to assume more of a biphasic pattern. So instead of waking up a bunch of times, it's more of a biphasic. And they have earlier mornings and a great love of nap times, which I can appreciate. But for, whatever reason, I don't know why children and parents' rhythms weren't matched, but it does have to do with a lot of that growth that can happen. Children need more of that growth hormone that gets released from that stage 3. So, it can be quite a funny joke. And actually, adolescents, with their changing bodies and increased hormone requirements, require that longer stage 3 duration. And so they go back almost backwards to having somewhat higher sleep requirements. So we shouldn't necessarily be kicking them out of bed as early in the morning. Then, as we reach older age, there's this marked attenuation in the amplitude of the slow waves. So you do have this increased likelihood for the early risings, waking up throughout the night, and just generally a reduced sleep quality. So not always great. As you can kind of imagine, there are a number of issues that can arise with this disturbed sleep-wake cycle. There are 7 broad categories that we put sleep disturbances into, and they're actually outlined by the International Classification of Sleep Disorders, which is very fancy. So the first one, obviously, are the insomnia. So this is characterized as a difficulty falling asleep, frequent awakenings, including early morning awakening, insufficient or total lack of sleep, significant daytime fatigue, tiredness, or sleepiness, and a lack of concentration. Now, you can also have irritability, anxiety, and sometimes there's a depression associated with, especially more of that the chronic insomnia. And there's a forgetfulness, and again, psychosomatic symptoms such as those aches and pains can really start showing up. So, sleep deprivation is associated with kind of a number of more negative health consequences, which we will get into a little bit more. But, when we think of when someone is not sleeping, you can often tell, and it really has this huge impact on their quality of life. It can influence their immune system, cardiovascular concerns, increased risk of developing obesity, and Oftentimes we do see in these patients there's a characteristic elevated heart rate, elevated sympathetic, so that fight or flight, but a decreased parasympathetic tone, which is that rest and digest. So it has digestive ramifications, and then increased 24-hour and evening cortisol. The second kind of large category is chronic circadian rhythm disorder, and these are different, but this is a mismatch between the body's internal clock and the geophysical environment. So again, those light dark cues based off of your environment, which is why jet lag is such a predominant issue. So this can either be the result of a malfunction of the biological clock itself, or it's because of a shift in environment, like traveling, that causes you to be out of phase. So you're not responding to the cues that you should be given. So it's very much characterized by cyclic episodes of, really good sleep followed by really poor nighttime sleep. There's excessive daytime napping. And again, we see that in shift work syndrome, in jet lag cases. And again, and this is where our external cues are not matching up. The third category would be sleep-related movement disorders. And these are really interesting because they often arise from dysfunctions for changing structural functions. So what I mean by this is, like muscle relaxation can't be fully achieved, or it can be related to electrolyte imbalances, improper hydration, lactic acid buildup. So really what we're seeing is, the restless leg syndrome or like cramps at night. Parasomnias is the next category, and probably the most spooky, which is appropriate because 'tis the season. But these sleep disturbances are some really interesting. So, I mean, some are very more common, such as somnambulism, like sleepwalking, and some are not so common, such as the exploding head syndrome, which I hope is not as common, but it's probably an unpleasant sensation all nonetheless. So sleepwalking, sleep talking, night terrors, nocturnal enuresis really all occur during that stage 3 sleep, but you also get some REM stage related parasomnias, and these can be recurring isolated paralysis, and REM sleep behavior disorder, which, like I mentioned a little bit earlier, is the absence of that muscle atonia. So instead of being kind of paralyzed in the sleep, you're thrashing around and moving around. And it can actually cause, sufferers to really act out in vigorous and potentially violent manners. And I had also mentioned earlier that this condition, the RBD, is very strongly linked with alpha-synucleinopathies, which are just prodromal markers of dementia. So we know that that's associated with multiple systems like Parkinson's disease, Lewy body dementia. So certainly that's something we want to keep an eye out for. Then we have respiratory sleep concerns, such as obstructive sleep apnea. Again, often worse during those REM periods and lack of muscle tone. And finally, we have disorders where the individual is actually sleeping too much. So it's things like narcolepsy. So now that we know, the sleep classification for sleep disturbances, as well as the phases we should go through, I think it's really important to understand what is the impact that this has on various symptoms or systems rather, so that we can actually really understand, why is sleep so important? We kind of already know that sleep helps us with the body and brain tissue restoration. It helps with facilitation of waste clearance from the central nervous system, so kind of like a filter or a sieve. And it does so through helping the glymphatic system kind of filter everything out. Sleep is very important for energy conservation, adaptation, of course, memory reinforcement and consolidation. It creates these synaptic neural networks and really makes them strong and improves their integrity. Of course, there's the gene expression in sleep and wakefulness that starts to change, and that's related with with cell cycles, thermoregulation, and so much more. So there was a very important study, an epidemiological study, actually from 1979, that was a good foundation. But it said that you get increased chances of death from coronary artery disease, cancer, stroke, and they're greater for adults who sleep less than 4 hours or more than 9 hours. So this was really what set kind of that average for, get your 7 to 8 hours of sleep. So that study was quite integral to our understanding of this. And we're actually just seeing more and more reinforcement of this idea that there is a range. So there is such thing as too much and too little. So when we look at cell cycle markers and how our cells are going through their replication, these G and S phases are circadian. So it really suggests that that cell cycle is regulated under circadian gene control. So as studies into shift workers found, when you suppress the melatonin production and the cell cycle, it is kind of correlated with certain cancer types. So it's really important to allow for that proper gene expression. There was also a more recent study that looked into light exposure at night, increasing the risk for breast cancer, and these risks for shift workers and blind women who aren't getting those external cues. So how do we actually start supporting by resetting that circadian clock? So from a cognitive perspective, there's a clear bidirectional relationship where, chronic slow wave sleep, as we see in that deep sleep, and deprivation of that can actually lead to continuous elevation and accumulation of these beta tangles. And this was kind of theorized as a starting point for Alzheimer's disease pathogenesis. And according to this amyloid cascade hypothesis, if you highly upregulate your endogenous melatonin, it can actually slow that progression of Alzheimer's disease. So often that becomes a therapeutic target. We also, and I mentioned this earlier, see that a raised daytime sleepiness is linked with a higher risk for dementia. So it's really important that the sleep you get is good quality sleep. So chronic sleep deprivation can actually impair your glucose tolerance, which we'll talk about in a second, but having glucose intolerance can actually contribute to memory impairment, because what's happening is your hippocampus in your brain is not functioning as well. It's not getting those proper cues. Then I think when we think of sleep, we often think of it's restoring and helping our immune function, and we relate it to being really protective, and it does that through upregulation or production of a number of immune cells, cell lines. And another thing that is actually quite interesting that happens is when we sleep, we can get a better fever response, which is sometimes why fevers tend to rise at night. But if we're not necessarily sleeping or allowing that to happen, we're not getting that appropriate fever reaction, and that fever reaction isn't primed. So again, the T cell production is really important and can go down in sleep deprivation. Moving on to kind of the digestive and metabolic relationship, we know that sleep is very important to help regulate our appetite and satiety cues. It's very important for obviously the production of I mean, serotonin is important for sleep and vice versa, and eventual melatonin. And this can be related to obesity risks, um, changes in that migrating motor complex, which really regulates our digestive system, pushing everything forward. Um, and and we really need to reset it. So an increase in ghrelin levels is associated with short sleep, and that can reduce leptin. So the important thing here is that these differences in leptin and ghrelin is what it ultimately increases our appetite and prevents us from responding to these satiety cues, saying, "Okay, I'm full." And that's why there is this increased BMI that it gets associated with that short sleep duration. Something I think we don't see a lot of discussion on is the relationship with skeletal muscle. So in 2018, researchers found that skeletal muscle function can actually be impaired by even small changes to sleep, such as changing your work schedule from a day to a night for even 4 days. So you can imagine people who have been doing shift work, for 15 plus years, may have this change in their skeletal muscle formation. So um, it's really important to have a regular circadian rhythm to increase that protein content, improve the mitochondrial quality, regenerating and repairing cells of the skeletal muscle, and then to prevent that atrophy that can happen with your muscle. So there was a study relating to kind of the next section, which is hormones, and they showed that there was actually an inverse relationship um, reported for when you have a shorter sleep duration and the hormone levels in pregnant women. It can actually start changing that. So particularly, pregnant women, it's such a time of growth and change. They need to really focus on sleep, getting adequate sleep. Sleep is also able to increase the secretion of these anabolic hormones. So these are things like growth hormone, prolactin, testosterone, luteinizing hormone, and sleep will then also decrease levels of catabolic hormones such as cortisol. So even when we have partial sleep loss, it will alter this kind of hormone regulator known as our HPA axis, our hypothalamic pituitary adrenal axis, and that can lead to an increase in cortisol levels. So it's that chicken and the egg. Sometimes high cortisol will prevent you from sleep, and then it just exacerbates it and will elevate your cortisol and block the sleep-wake cycles, disrupting that circadian clock, kind of overriding those external cues. And you can really see this with patients or individuals who suddenly get really full of energy, this burst of energy around 11 p.m. And suddenly they're like, I can solve all the problems at 11. So let's do a little sleep personality poll just to make sure everybody's still awake. And so who are, the night owls versus the early risers? So I think yeah, we'll just give that a few seconds. We want to make sure that sorry, there's personnel. So there are the night owls, and then there are those who know themselves as larks. And have you ever kind of wondered why some people, we're getting about 50-50. So why are some people more the night owls, and why, do those other people just naturally tend to wake up early and get started earlier in the day or function higher? Well, there does seem to be this genetic polymorphism that's related to, you know, there's this 9-item, I think, questionnaire that was developed to kind of determine your morningness or your eveningness. And like I said, there is kind of that genetic polymorphism that's related to that. And they discovered that this was in the clock genes, and it was associated with human diurnal preference. So just gives us a little break. Now let's try to understand, aside from our genetics that give us a preference to morningness or eveningness, we obviously want to, when we're approaching sleep dysfunction, we want to establish some clear root cause approaches to that management. So what that ultimately means is we need to reset the clock, and we need to help individuals with sleep latency fall asleep, and we need to help them stay asleep. And then, of course, we need to develop rituals before sleep to help improve that sleep. So it needs to be a really comprehensive, well thought out process. So chronotherapy, which is the intentional delay of sleep onset by 2 to 3 hours on successive days until you've kind of reached that desired bedtime, is a key treatment approach for managing that circadian regulation. So you're kind of restricting sleep in the evening or in the morning until you get to that kind of ideal time. And this is really helpful when we do east to west travel. And for shift workers, it's really important that they block off a consistent overlapping hours where they are sleeping. So irrespective of what their shift is, at least they know that from 1 to 3, they will always get those 1 to 3 hours. Then oxidative stress, we always need to manage that, because what it does is it blocks a lot of the clock gene function, and ultimately disrupts that master pacemaker. So we have to mitigate, usually using antioxidants, things like resveratrol found in red wine, EGCG found in green tea. These can all be really helpful. Then we consider when we're eating food. So time-restricted feedings, there's this extensive reciprocal relationship between the regulation of our circadian clock and nutrient metabolism. So that what that means is your daily eating pattern can affect the amplitude and the phase of your circadian rhythms. So this time-restricted feeding, or TRF, if you will, is actually one of the only eating patterns that doesn't require a caloric restriction. So we're not necessarily saying that you have to reduce calories, but you do want to make sure that you're relating it to circadian biology and allow the body a true daily fasting period in which only water is allowed, or essentially anything that's less than 5 calories. You want to avoid things that contain caffeine, artificial sweeteners. We want to keep all those out. But having time-restricted feeding allows us to have the capacity to prevent some of those age-associated gene reprogramming. It helps us to restore that homeostasis, ultimately making our sleep-wake cycles a bit more efficient and protective. So really make sure you're giving yourself sufficient time before bed where you stop eating. You don't want to eat and then go to bed half an hour later. Let's also consider the role of light exposure. So when our retina is exposed to light sources, and it can be as low as 1 lux or less of this monochromatic light at a short wave, and that short wavelength is usually blue appearing light, what happens is it can significantly lower the nocturnal melatonin production. So as low as less than 100 lux of that broad spectrum fluorescent lighting that you see in workplaces often. These same light levels can actually elicit some pretty significant phase shifts of our circadian clock. And what that does is it directly can shift our alertness, and it's opposite of what we want to do when we're trying to wind down and sleep. Something called bright light therapy almost seems counterintuitive based on what I said, but it's actually administered for the treatment of these sleep disturbances in circadian rhythm. So what it's making sure is you're getting the proper quality of light, and the patient is actually sitting in front of the light for about 30 minutes in the morning. And the room light must be reduced then in the evening. We want to make sure that there's no ambient light or light from the street or battery packs or TVs or anything. So it can be really helpful, this bright light therapy, to address circadian dysregulation, cognitive function, and they did see that it helped improve sleep in dementia patients after 2 hours for 10 days of a bright light therapy. So what they did was they also examined the melatonin at bedtimes in combination with that bright light therapy, and they actually found that they had even more of a pronounced benefit. So the combination bright light therapy, restricting ambient light in the evening, and then also melatonin supplementation for kind of a starting point for that circadian regulation. The second approach to treatment is kind of the starting point that really can correct the sleep disturbance. It's often, sometimes the simplest solution is the most beneficial, and it's really accessing and understanding why we have this inability to fall asleep. And to do that, we need to understand what makes us sleepy. So that biological clock can affect our sleep and wakefulness. And of course, sleep and wakefulness affect the clock. And there's two variables that seem to play a role in regulating the timing of the sleep. So like I mentioned, sleep and wakefulness are controlled by homeostatic mechanisms, or just our body's desire to reach this balance, as well as, like I mentioned, the circadian factors. So the homeostatic factors really tell us our propensity or our desire to fall asleep. Let's say we kind of need to recover from a sleep debt. Let's say we were staying up all weekend, binging, I don't know, some random TV show. That additional amount of sleep is our sleep debt that we need. And the recovery is not linear. So it's not like I didn't sleep for 8 hours, I must recover by having 8 hours of sleep. So homeostasis means that our body wants to get us back into that alignment, so it will recover kind of that sleep debt, or repay it faster than we may need, and it allows for an adequate amount of that slow wave sleep for that restoration. So that phase 3 stage of sleep is really governed by these homeostatic mechanisms. So it's, I guess, essentially what all of this is saying is how we act throughout the day, our environment throughout the day is really going to change our propensity or our desire to fall asleep. So we really need to be cognizant of what we're doing during the day to get proper evening sleep. And then from the circadian factor, that timing, duration, characteristic of sleep begins to change, because this is more associated or regulating that REM stage of cycle, REM sleep cycle. And also it can, shift things like inflammatory factors or IL-1, which help us actually fall asleep. So all of these things are desire to fall asleep. So when it comes from a management perspective, certain substances can regulate those homeostatic factors and help us actually fall asleep. So there's this concept of sedatives versus hypnotics. So both are working on, depressing or quenching your central nervous system. Sedative is calming and really great for anxiety, racing mind, while a hypnotic tends to more induce drowsiness and is more for that significant sleep deficit. So the higher doses of a lot of sedatives can become hypnotics, and they do include sleep cycle changes. So it's important to consider that when we're talking about hypnotics, they require more vigilance and monitoring for symptoms. How alert and awake do you have to be? Because if you're completely, zonked out, in case of an emergency, do you have a job that requires you to be really alert? Um, and actually, botanicals are a well indicated and kind of easy way to administer. You can give them as teas, tinctures, or dried extracts and supplements. Some of the ones featured here are the chamomile, skullcap, passion flower, and they're all more sedating. And as you increase the dose, they can become hypnotic, particularly the passion flower. And there was a passion flower study published actually in just earlier this year in 2020 that it was a double-blind randomized placebo-controlled trial, so kind of that gold standard, and it assessed the efficacy of passion flower extracts of both the leaves and the fruit versus placebo, and it gave them to subjects nightly for 2 weeks. And these were patients who were suffering from chronic insomnia. And after 2 weeks, sleep quality was assessed, and they were looking at what was your total sleep duration, the sleep efficacy, sleep latency, and the total number of arousals or waking up after the sleep onset. So the assessments that they used were this Insomnia Severity Index. This is the ISI. You'll see that in a lot of studies get used. Also the Pittsburgh Sleep Quality Index. Again, I feel like I apologize if this is a little bit more technical, but these are essentially saying they were well-validated questionnaires to determine, how much the sleep had improved. And they found that from the 84 participants that completed the trial, there were no adverse events, so fairly well tolerated. But the passion flower group had an improvement in all of the parameters, which is pretty impressive. Then we look into things like L-theanine, which I had mentioned way back at the beginning of this. This is an anti-stress effects, and a key study looked at the brainwaves of 50 volunteers, and they were given 200 milligrams of L-theanine once a week, and it actually increased those alpha pre-sleep waves for 40 minutes after ingestion. So it's really linked to that relaxed wakefulness, but not necessarily a drowsiness. It also decreased anxiety. A lot of people can't fall asleep because they have more anxiety or racing thoughts. And we saw this benefit with the L-theanine. It also helps with your cortisol awakening response, which we haven't talked about yet, but like I said, some cortisol dysregulation is a part of sleep disorders, so it can be quite helpful with that. It was also studied in patients with schizophrenia and ADHD, so if there are sleep-associated concerns there, L-theanine is a nice, helpful therapeutic target. Ganda. Ashwagandha is kind of like the Indian ginseng, they say. It's a very calming herb. It's used in menopausal related insomnias. Things like GABA. This is our main inhibitory neurotransmitter, and we'll talk about in a little bit. Sometimes simple magnesium in a bisglycinate form can be quite relaxing to the muscle and help with sleep onset, because again, it's preparing you for that relaxation phase and not hyperstimulating. So we really don't need to overcomplicate it. Sometimes we just need to quiet the mind significantly enough before bed. A big criticism, I think, that we see of many of the pharmaceutical management options for sleep is that while they will help you fall asleep very, very quickly, they'll kick you out of sleep and and then you kind of wake up in the middle of the night very groggy and kind of not really knowing where you are, and then you have a Tiger Woods moment. Um, and you're not getting that deep and restful sleep. You just think you are. So staying asleep is really important, and really making sure that we're getting enough of those sleep wake cycles so that we have that deep stage 3 and the REM sleep. We can make sure that we're maintaining sleep through kind of a number of ways. One, appropriate supplement timing. So like I had mentioned, that slow release or immediate release melatonin is really going to depend on the population. I wouldn't say slow release for the elderly population, but it may be sufficient for someone who's got shift work. And melatonin production in the individual already, we can kind of assess for that using some urine tests, so people can gauge what's appropriate for them. But usually for the most commercial preparations, you want to take it 30 minutes to an hour before the patient is going to bed. And then obviously on average, there's about 30 minutes before people fall asleep, and then before midnight. So they still have 2 hours to get that endogenous peak. So you're not necessarily disrupting endogenous production, but you are supporting it. Then you can consider botanicals and neurotransmitters that actually help you stay asleep. Things like valerian. There was a study again in 2020 that was looking at botanicals and sleep, and valerian, that arm showed that it's not only reducing the latency of slow waves, so it gets you into that stage 3 more effectively, and it improves sleep quality for a third of, like 1 in every 3 participants, whereas placebo was 1 in every 10 participants. So pretty good. And then another trial showed that it helped 89% of people fall asleep, 80% of people stay asleep, and 82% saw improvement with their anxiety. So valerian can be kind of a nice option. Oh, my little picture with the valerian isn't there. It's also very beautiful. So thermoregulation is also really important when we're trying to stay asleep, because if your body is trying to compensate for a very hot environment, then you get kicked out of those deeper sleep states. But then, of course, you can't have it too cold, as we know, because in our REM state, our body loses, it's less efficient at thermoregulation. So it can't be an ice chamber either. So this is a Goldilocks situation. You want to make sure that you have an appropriate temperature for you. You also want to prevent any respiratory or restrictive sleep disturbances, ensure proper airflow through nasal passages, get humidifiers and air purifiers. You can consider air purifying plants, aloe eucalyptus in your environment where you sleep. It can be quite calming to that nervous system. Then consider the landscape that provide that structural support and optimal comfort to ensure that you're staying asleep. So this is a mattress, pillows. What's the configuration with your partner and pets? It can actually improve your sleep quality because there's this protective and comfort cues. But of course, we know that sleeping with someone else can cause a whole host of concerns, from noises and odors, and maybe just make sleeping alone worth it. But really find an optimal sleep environment for you, and consider that landscape. I want to go, and we won't spend too much time here, but discuss the neurotransmitters that help us stay asleep, because of course the big ones are melatonin, which we already talked about, but also serotonin and GABA. So we kind of talked about GABA in the fall. An inhibitory transmitter. It has a very calming effect on the nervous system, and it reduces that time needed to fall asleep by up to 20%. So in terms of staying asleep, it does prevent the transmission of impulses between the synapses. Again, it's inhibitory, and it's a target for all three classes of anxiolytic medications. So again, for those people that have anxiety-related insomnia. Then we consider serotonin, which, as we know, is very important for anxiety and may also help individuals who suffer from that anxiety-related insomnia as well. And we know that it's a precursor to the melatonin, which we talked about earlier, and increases our REM cycle. So the second intermediate, N-acetylserotonin, is actually being looked at and investigated a little bit more because it's showing that it can improve circadian rhythmicity, and it's being investigated for its kind of potential independent effects on sleep regulation and its use as a supplement. So it has been something I think that we use a lot in supplementation, but since about 15% of our melatonin gets converted back into this N-acetylserotonin, the exogenous administration of the NAS can play a role in stimulating and increasing neurogenesis, which is this process whereby we're actually creating more brain cells or proper nerve conduction. And that has a positive influence on memory, mood control. It can mitigate the development of a lot of neurological conditions. So it kind of does it through something that we've talked about in many webinars past, but brain-derived neurotrophic factor, BDNF, which has this protective role, and it regulates our neuronal activity. So it leads to normal day-to-day function. So what's really cool is that this is just kind of this exciting new therapeutic target, and it can have more long-term effects on our learning and memory consolidation. So I know I went through that quite quickly, but we need to kind of consider, and we probably see this stat thrown around or this image thrown around a lot, but we've all kind of been hit over the head with this idea that the 90% of the serotonin we make is actually made in our gut. So gut health, that relationship between your gut and brain connection is so important. So to correct those underlying issues, we need to kind of first start at healing the gut, identify any foods that are disrupting your microbiome, seed with proper probiotics, ensure you're getting enough fiber and sufficient stomach acid to make sure everything's moving unidirectionally. We're not getting bugs sitting in the small intestine where they shouldn't. And we really need to make sure that the parasympathetic output is appropriate. So that's also really important. If people aren't sleeping and they're not really responding to things, let's look at the gut. Okay, so this is probably a huge, it could be its own lecture, and for the sake of time, I just wanted to briefly mention the fact that the endocannabinoid system is this now system that we're, I think, understanding more and more, whereby we can activate, it's kind of like your body's first responder, and it has been shown to be beneficial in sleep. People also find benefits with exogenous or plant-based endocannabinoids such as CBD or full spectrum CBD, but you can also get endogenous, so something your body produces itself, from palmitoylethanolamide. And I won't spend too long on that because there are quite a few webinars relating to the PEA itself, so you can check those out. But I do really want to get to, it's really important to have appropriate sleep hygiene. What I mean by this is we need to reinstate a consistency, a daily routine, and it's important to have, appropriate sleep hygiene. So the way that we talk about hand hygiene. There's also sleep hygiene, a good way to do it. And this includes, dietary changes, stress management, environmental changes, and behavior modifications. And all of these ultimately help us address, comorbidities and get to the root cause. So when we're talking about dietary measures, I kind of already discussed, you need to avoid caffeinated beverages, alcohol, and tobacco in the evenings, especially. Avoid any inflammatory foods that may be preventing any of your nutrient absorption or proper gut-brain axis communication, like I said, with the serotonin. So time restricted eating and balancing your blood sugars, as really high sugar before bed can result in that glucose intolerance that was mentioned earlier. Stress, of course, must be mitigated, and understanding that cortisol awakening response, how our body wakes us up, is often with that cortisol, and elevations can result in that insufficient sleep. So that will have downstream effects on your melatonin production, while depressions in that cortisol awakening response can relate to the circadian clock delay. So try to utilize apps like Calm app, or consider meditation and stress management tools, and strategies like therapy. Consider the environment. We really need to reduce the noise. We always talk about kind of ambient light, but ambient noise is also associated with disrupting that pineal gland function. So particularly in elderly patients who are in institutions, and may have had decreased exposure to light, they also found that increased noise kind of in hallways or on the road can disrupt that. If you can't avoid it, consider things like earplugs. But having a better nighttime sleeping atmosphere does mean less noise. And a study in nursing home interventions showed that by reducing that, they could then enhance the physical activity and daytime alertness in some of the subjects. Eliminating all the ambient light, that really includes battery packs. Consider filters over your screens, nighttime filters that eliminate some of that blue and make it warmer tones. And any screen use, assuming that it's dark out, try to, again, temper the intensity, and don't use overhead lighting. Try to use more lamps and side lighting. Also, I mentioned the use of our beds. So don't watch TV in bed or read. Really try to restrict your bed for when you want to sleep. So go to bed when you're actually tired. We tend to use our beds for too much. So excessive time spent in bed awake led to poor adherence to regular sleep-wake cycles. So that's important. Avoid exercise later in the day, especially if you already have elevated nighttime cortisol, because this is going to exacerbate and worsen any sleep dysfunction. So try to do it earlier in the day. Also, if you're very, very low cortisol and have quite a lot of fatigue, then aggressive evening workouts may be quite depleting and not as nutritive. Also then consider what are comorbidities, anxiety disorders, depression, schizophrenia, ADHD. Certain medications can worsen it. So we really need to consider what the comorbidities are to really try to understand what the therapeutic potential, or what the next step is, to really not just the sleep dysfunction, but really address it from a root cause perspective, prevent it from further worsening. So I just want to, we have a few minutes for questions. When we consider, how long we need to be on a lot of these, it really depends on have we addressed the root cause, and utilizing subjective and objective scales and assessments, keeping sleep logs. You can also look up the Epworth Sleepiness Scale or Berlin Questionnaire. Looking at your medication list and going through them with your doctors, we talked about serotonin a lot as a target, but really being cognizant of not mixing that with other medications that may also increase your serotonin and cause you to have kind of more of a serotonin syndrome. With botanicals, maybe pulsing. Some of those botanicals are switching up from passion flower to valerian or things like that. Just, you can wean on and off, take drug holidays, and then also consider cortisol management, and then try to pair your day and night routine. So have your B vitamins earlier in the day rather than later. And sorry, just going back to the comment about the drug holidays, I meant supplement holidays. So you can kind of reassess and see if you continue to need a supplement or if not. So I'm going to just open it up to any questions we may have. Again, I apologize for going over a little. Any questions there? Okay, so it looks like we are out of time. So I just really want to thank you all for your patience and for bearing with me. I have a list of all my references from some very intelligent people. Please check them out. If you do have any questions come up, please email marketing@aor.ca. It's marketing@aor.ca. Our next webinar is actually going to be Tuesday, November 17th, and it's on a natural approach to men's health. It's going to be presented by Dr. Aaron Zadek, and it's 12 p.m. Eastern Standard Time. Thank you again so much. I appreciate your time and your participation, and I wish you all a safe and happy week ahead. Bye-bye.